I'm very happy to see that. Actually, I guess he wouldn't say it himself, but Marius is one of the most frequent speakers in Europe, I guess. We have met at different conferences, digitally and not so far in person. So yeah. I'm really, really happy that you could come to us here in Stockholm. And I think you should know the background also, and he will, of course, tell us about it. But, you know, as a former policymaker myself or legislator, to really process from an idea to come actually to a legislation, it takes time. It takes several years to come there. And Marius, I guess you have worked several years also with this, but so satisfying when you finally see a result. And I think we should all look at this example for something that is possible. You know, everything starts with an idea, but how to do the process is really something that we all need to learn and to renew our knowledge sometimes. So I'm so excited really to hear how this has developed over time and to see a result like this. So please give a hand to Marius Geanta.
Thank you. And thank you, Pernilla, for the invitation. I'm very happy to be here today. I don't know if I'm one of the most frequent speakers, but it's sure that I'm communicating a lot on social media. So perception is probably everything. Very happy to discuss about the first in the world law on the right of the citizen and patients to personalized medicine. So this is the initiative I'm very proud of, and it did indeed took us about 9 years working on the topic of personalized medicine in my home country, in Romania, until this became a reality in terms of legislation. So everything starts with an idea, but should be a very good one. And this is actually not just a famous quote coming from Wayne Gretzky, I skate to where the puck is going to be, not where it has been, but is our inspiration at the Center for Innovation in Medicine. Our organization is a not-for-profit focusing on policy, especially in relation with personalized medicine and health innovation, but also on research, and I will present you tomorrow one of our research projects on cancer primary prevention. So we are always thinking, you know, where the puck is going to be, and 10 years ago, more than 10 years ago, I was sure that one day the puck will be in the field of personalized medicine, precision medicine, and so on. I was very happy to see earlier today that Paolo Parini actually presented the two concepts of complex ecosystem and complicated ecosystem, and I think both are key ideas in relation with personalized medicine. So usually I present this image for many years to different audiences, and if I ask, of course, a molecular biologist, for him or her, it would be very easy to say that, you know, this is a cancer pathway or many cancer pathways, and this is true, in fact. But I asked also the patient groups and patients, and they said, you know, this is like our journey in the different health systems. And I said, you know, this might be right. But I also asked the politicians and decision makers, and some of them agree that this is the way the legislation is, you know, is negotiated and is done. So many ways to interpret an image, but is this idea of complexity. And I think Paolo Parini explained very well today why we should consider a complex ecosystem, this ecosystem of personalized medicine or network medicine. But it's also complicated, which is a slightly different, because if you look to different fields, the different building blocks of personalized healthcare, you can see that we can split them in planning and enablers, health information, data infrastructure, services, health products, each of them having different other building blocks. And the idea is, if you identify that a certain building block is crucial to move things forward and you target properly that building blocks, you will have a result or the expected results. This is the difference between a complicated system and a complex system. When it comes to personalized medicine, I started to be interested in 2011 with the first ever conference on personalized medicine organized by the European Commission in May 2011. And I said, you know, this definitely will be the future. We are now 12 years later, right? Definitely this will be the future. And I said, you know, I should start speaking about personalized medicine with all the target groups and audiences in Romania. And of course, being an idealistic person, I expected actually for the people once become aware of personalized medicine and what this means, and especially in the field of oncology, to start implementing this. But wasn't the case. So we tried to use different methods, different ways to set the agenda at the national level for personalized medicine. And one of the ways we did that was actually to ask the Romanian citizen, have you ever heard about personalized medicine? And we asked this in 2016, 7 years ago, 2018 and 2020. Of course, we asked about biomarkers, we asked about personalized medicine and immunotherapies, immuno-oncologies. As you can see, 1 out of 3 Romanians said that they, at a certain point, being aware of personalized medicine. So this was very useful to understand at the societal level what is the level of awareness, and was very useful between 2016 and 18. Our group was the only one communicating personalized medicine, and you can see a slight increase of the awareness. But then between 2018 and 2020 were other groups that also started to communicate on health innovation and personalized medicine. And the results in 2020 was a decrease of the awareness of personalized medicine. And this was a way for us to identify actually infodemia in relation with health innovation, in particular personalized medicine, in 2020 compared with 2018. In other words, a lot of information with a very low value for the citizen, like a flood of health information, especially in the digital world. So for a person was really tough in 2020 compared with 2018 to identify what is relevant in terms of, in our case, of perception of personalized medicine. So we try to discuss with all the audiences in the last year, and our approach was actually to look to the science and innovation, then to go to the policy and regulation, and to try to implement in real life and to capture the experience. In 2015, the Council of the EU in Luxembourg defined the personalized medicine as a medical model using characterization of individual phenotypes and genotypes, such as molecular profiling, medical imaging, and lifestyle data for tailoring the right therapeutic strategy for the right person at the right time, and or to determine the predisposition to disease and or to deliver timely and targeted prevention. So I think this definition, 8 years after, I think it's a very, very good one, and discovering actually all the important pillars of the personalized medicine. So the definition was put forward by the Council in December 2015, and 10 months later, in 2016, we organized the first conference on personalized medicine. This is not a news, necessarily news, but what was very important is that we organized this in partnership with the Romanian president, and the Romanian president was the one actually who hosted the conference. And this was crucial in order to have this very high level of engagement with the president, and then we had similar approaches with the parliament, our annual events, Science Meets Politicians, and so on and so forth. So we started in 2016, very early, the engagement with the president, and I have to say that the health advisor of the president was the one actually who supported us all the time. And after 2 years, in 2018, we organized in the same format, same place, the second conference. And we invited people across Europe, of course, European Commission, and other scientists and clinicians, trying to understand, of course, patients in the industry, trying to have this multi-stakeholder approach and to understand what are the challenges and opportunities for personalized medicine. But at the national level, we actually acknowledge year by year that, you know, the speed of implementation is not the speed we wanted. We are 12 years after the initial personalized medicine conference. And we said maybe it's time to start thinking in a different way and to complement this bottom-up approach, trying to implement personalized medicine on different layers with a top-down approach. So the idea was to find the right moment to start discussing with the decision makers about something different. And I already mentioned that we started in 2015, 16, and it's very important in 16, the IC permit, and I'll refer a bit later on this, was established. So this is a perfect match between what was happening at the European level and the national developments. And in 2018 was a consultation on the consultative committees of the Ministry of Health, are the group of clinicians mainly that advise the Ministry of Health on how to do things in different therapeutical areas. And at that point, we actually convinced the Ministry of Health to have a committee on personalized medicine. So we actually try to use all the opportunities that came from the government and so on in order to put our topic on the agenda. Then, you know, all the developments in the field of cancer at the European level. And in 22, and I have been part of the working group of the National Cancer Control Plan that was approved as a law by the Parliament and promulgated by the President. And at that point, in the discussion I had with the politician who heavily supported the National Cancer Control Plan to be a law, we said, you know, we cannot discriminate between the cancer patients that, according to the law, will have access to personalized medicine, because the law on the National Cancer Control Plan is very well aligned with what is in the European Beating Cancer Plan and Cancer Mission. The recommendations and actions are in the law. And we said we cannot discriminate between the cancer patients and the others. And they asked me, you know, what is your suggestion? And I said, you know, we should have a law on personalized medicine and to state this as a right, actually, for all the citizens and patients. And I had a discussion with the lady here, Nicoleta Pauluc, is a member of Rumäniens Senate, and of course with the Romanian president. And I think the key was to deliver the right message at the right time to the right person. And this was the way the law of the right of the patients and citizens to personalized medicine became a reality in May 23. And this law actually is completing the law on the patient rights. So this was again an opportunity, because the law on the rights of the patient's rights is already part of the legislation for many years. So wasn't so tough to to adapt and to include this. Very important, the law included the definition of the personalized medicine according to the Council of the EU. I think this is very important, because the future initiatives could be research on implementation or clinical practice will have a foundation in terms of legislation. The law states the right to personalized medicine according to a medical recommendation. And I have to say that our initial proposal was to state this as a right, not including the medical recommendation, but the Minister of Health said, you know, this should be according to the medical recommendation. As I say, you know, this is even better, because in this case, the healthcare professional should be aware, should be trained of, should be educated in order to provide the right personalized intervention to a person. So it was finally very, very good, very, very good. Of course, is mandatory the informed consent, and the healthcare professional should provide to citizen and patient all the information, including risk benefits, is what I already explained about the role of the healthcare professionals. And of course, are some remarks in the law on collecting, sharing, standardization, and primary use of data. This is very important because no other references to health data are in the national legislation. In terms of potential impact, I think this one marked in red is the most important. After the law was promulgated, Romania finally decided to sign 1+ million genome declaration and to become part of this. I have been delegated to be one of the 2 representatives in the 1+ million genome member states group, and also joined the GDI project, and probably will join the Genome of Europe application that will be put forward in November. So having the legal background was easy to engage with, in this case, with the Ministry of Research, and to explain why it's so important to sign the 1+mg declaration. So, the story of the law on the personalized medicine actually can be easily summed up with the story of these 3 gods. Of course, the most famous is Kronos, who is the god of the past, present, and future time. Aeon is the god of eternal time, and Kairos is the god of opportunistic time, and he's my favorite, I have to say. I have to say. But moving forward, I have been last week actually in Valencia at 32 degrees, so it's a thermic shock for me to be here in Stockholm after 2 days. So in Valencia was organized the high-level conference on personalized medicine under the Spanish presidency of the Council, and the key moment was the official announcement of the European Partnership for Personalized Medicine. It's a key moment for what the personalized medicine will mean in the next 10 years in Europe. And I don't know if you can see, but here with the mark in red is the reference done by the coordinator of the EP permit on the law on the right of the citizen and patient to personalized medicine, highlighted as a very good example on how to move forward with the personalized medicine agenda in Europe. Just to say a few words about the European Partnership for Personalized Medicine, actually there are 3 pillars. One is research, the other one is innovation, the third is implementation. And from a patient perspective, I think are of very high relevance the 5 triplets of action extracted from the strategic research and innovation agenda for personalized medicine that will actually drive all the activities of the EP permit in the next 10 years. One of the triplets is referring to generating patient-centered care pathways. I think this is heavily related to our today discussion. Then is the building feedback loops from clinical application and patient experience to research and innovation. Then improved awareness for patients and citizens for personalized medicine. training and education of people and patients, and interdisciplinary personalized medicine research projects co-developed with experts in social sciences. So our 57 triplets of action, in other words, priorities identified in the SRIA, and 5 of them, 10%, are referring specifically to the patients and citizens. This is very important for the personalized medicine and collaborative project that will be in Europe in the next 10 years. And this is my final message. We are now, because actually in Valencia was also a fashion week or weekend, something like that. I'm not so familiar with the fashion than I'm with the personalized medicine, but was even for me very clear that are some types of creations, right, in the fashion, but I think it's the same for healthcare. But the idea is to use all our resources to move from one size fits all to haute couture, high personalized approaches. So thank you once again for the invitation. Very happy to be here.
Thank you so much, Marius. And I think, as I said, we should really have this as an inspiration, because things take time, but it's important to have the goal and really to see what will be in the future. And I just wonder, you know, when you started this work, you could see it from a medical perspective, but it's so much more than that with personalized medicine. Yeah. Can you explain the value for society in a way?
Actually, the term we started to use this year in our group is human-centric personalized medicine, and I will try to explain this. It actually was explained already, because it's not just about biologic, genetics, biomedical field, but are very important at least 2 layers. One is the individual layer, what are our attitude and perception and values and individual behavior, and we started to measure this 7 years ago. And is the social tissue that is surrounding us, and all this data actually should, all these layers should drive us, you know, to collect the data and to build new models of personalized medicine. Because, and I will give you one example. You might have a very good, let's say, comprehensive genomics test for cancer, but if a person has a very high level of fatalism and he or she believes that, you know, cancer means death, probably will not go for the genomic comprehensive test that might, in theory, can save or prolong life. So this is the role, and it's just an example, and this can be as well important for the members of the family that might influence a person. Again, is the same, and going to the health system, we can go in the same direction. So it's very good to see the advancements in the biomedical field, but we should start looking to the other factors as well to build a more complex model. Okay,
yeah. You know, the next seminar we will have in Swedish, unfortunately, is really taking the point of, you know, from is it the value of precision medicine for society? So I'm sorry, it's not in English. I guess you would have had some point of views. But I mean, to just have another question, is it really something that is possible to do for a whole country? I mean, if you now have a legislation in Romania that, according to medical recommendations, you have the right, actually, to have a personalized medicine treatment. Yeah. Is it possible?
You know, the law will not change alone anything. That's why I said, we started with to build the bottom up, and now we have the top down. I think we should find ways to put them together, and the approach actually, and the idea to identify the right moment, actually to intersect them, is what we should do next, because we shouldn't stop. We have the law, and this will solve, and will not solve. So, but we have, I think, a very powerful tool now in our hands as citizens to say, as you said, Penila, it's all right. Let's see how this can become a reality, having in mind that everything should be evidence-based. So we should wait for evidences to come in other areas than cancer. But if we discuss about cancer, there are a lot of personalized medicine tools, approaches, methods that can be immediately implemented in order to respect this right. Yeah.
Okay, thank you so much.
Thank you.
I think we can give a hand. Okay? Yeah.
Thank you.
Tack så mycket. Nu ska vi göra en sån här kollektiv rörelseövning igen. När vi ska förflytta oss eller sitta kvar. Det går bra vilket som. För att vi har ju seminarier på svenska och engelska samtidigt. Och det är under samma paraply någonstans här. Så. Men stannar ni kvar här, då får ni lyssna på Sineva Ribeiro och mig och även Rosie Verendel Nyberg. Så att det är bara att välja. Vi startar om 5 minuter. Välkomna igen.